April is Child Abuse Prevention Month, and here to discuss this with me is Nurse Higgs of the Suspected Child Abuse and Neglect Unit. Good morning and welcome to Bahamas at Sunrise.
Good morning.
All right, so we've got SCAN, right? Tell us, what is SCAN? What is your role?
Okay, so SCAN is the acronym SCAN, and it stands for Suspected Child Abuse and Neglect. It's a unit, it's a specialized unit in Department of Public Health and Wellness.
What are some of the things that you do?
So we manage and we support children 0 to 12 years,
Okay.
and their families who who suffer the crisis of abuse.
Okay.
And so we don't work alone. We network and we collaborate with other agencies like Accident Emergency,
Okay.
the polyclinics, Adolescent Health, Ministry of Education and School Health Services, CDU and Forensics, and social services in particular, the Child Protection Unit and Health Social Services.
Okay, so once the child is identified through one of those agencies, then they come to you, they
Then
bring them to
pick them
you.
up,
Okay.
yes.
So what happens at that point? Once you recognize that a child has been abused in whatever way, then what happens?
So once we recognize that they are abused, they are sent. Well, we are managed by what we call the pediatric adolescent protocol,
Okay.
and so you have to decide whether it's an acute case or it's a cold case. So the cold cases goes through the public clinics, and the acute cases goes through Accident Emergency. So once they pick those children up, then a referral is written, and we go ahead and pick those referral up and we bring them into our clinic.
Okay. And once they come to you, like how long do they stay there? What type of a program is it? Do they stay overnight? Or are they just seen and then released? How does that work?
Yeah, so we keep them in the clinic for a year.
Okay.
So we manage them for a year, support and manage them for a year. So you'll come to us the initial visit, and then 2 months, 4 months, 6 months, and then we discharge them.
Okay, so they're living there? Like how
No.
So when you're
It's a
sitting there,
clinic.
like, oh, okay.
Yeah, it's a clinic.
Just making sure, like, this is a high-tech clinic. Like, we got the kids living on property.
No,
okay.
it's a clinic.
So they come regularly for a
Yes.
year. Okay, all right. And what are some of the things that you see? Because I mean, there's different forms of abuse, and all right. So I mean, like there's neglect. There's the sexual abuse. What do you often see coming into your department?
Yes, the main one we see is the sexual,
Okay.
even though the physical is there, and the neglect and abandonment.
Okay, and you said 0 to 12 years.
So
Wow. So what are the ages that we're seeing that you tend to see sexual abuse?
mostly see the primary school children,
Okay.
but then we also see the junior and the senior highs as well. But they don't usually come to us. We cut off at the 12-year-old,
Okay.
and then the older ages go to another clinic.
Okay. And so what type of service then is provided at the clinic for these kids once you find out that, that there's sexual abuse involved? What is that? What are the sessions like? What's the therapy like for those kids?
Well, doctors see them, assess them, examine, and their families, and then we also offer the counseling, but they go to the crisis center with that one.
Okay.
Yeah.
And how do you find, because I'm thinking, for someone that would have been abused, like that's a scar for life, right? Do you find that kids ever bounce back from that? Are they normal after that? Or do you find that they're always sort of wounded? What do you find from your experience?
I think that they tends to bounce back, but not. The counseling helps. You see, they gotta have that ongoing counseling in order to help them to heal.
Okay.
Yeah.
Okay. And you talked about the various agencies that I guess pinpoint those kids with abuse, and then they come to you. Yeah. But for a kid that might be sexually abused and there's nobody really noticing it, you know what I mean? It's not picked up in the home. You're talking about a kid, 0 to 12 years old. That's a very young and vulnerable age. How do those kids go about getting support? Like what should they do? What can they do on their own if they are being abused, but there's no support maybe in the home?
Well, we usually tell them, tell somebody.
Yeah.
Somebody will listen, somebody will hear, because sometimes, because of that age, parents sense, you're not telling the truth.
Yeah.
And so we tell them to tell.
Yeah.
Tell a trusted individual, an adult, who will hear them and and offer some help.
Yeah, and just from the perspective of a nurse, what advice would you give to young kids, just to sort of prevent this, right? To prevent the sexual abuse. Like, what are some things that we can say to kids now to help them just to be on the lookout of this type of behavior?
When it's like that, I feel as if it's still like the village. The old saying say it takes a village to really raise a child. And so sometimes parents are not available because, nowadays parents really work.
Yeah.
And so some children tends to like, really on their own kind of a way.
Yeah.
And so the village have to get back into play and be on the lookout, and, watch out for these children and help with the protection, making sure they get where they're supposed to be going safely.
Yeah.
Yeah.
And what are some things, because I like how you brought up the village, right? So everyone should technically be watching.
Yeah.
People in the neighborhood, the teachers even, anyone that comes in contact with these children. So what should they be looking out for? Are there warning signs that we can look out for to tell that, there's a kid that's possibly being abused and how we can then help? What should we look for in those children?
So you have, you might see unexplained bruises.
Okay.
Marking, burning on the skin. You might see signs of neglect, like they may be malnourished or poor hygiene. Okay, they may show changes in behavior. You might see changes in behavior like withdrawn. They're anxious. They have problems trusting people.
Yeah.
Or they're fearful to be around certain adults.
Yeah. I mean, that's so important. And then what can we do? What can people in the village actually do to help these children?
Okay, so if we are responsible for one another.
Yeah.
We got to remember that we are responsible for one another. And so if you see something, you hear something, you know something, you have to open your mouth and speak up and say something.
Yeah.
Reporting is not accusing, it is protecting.
Yeah.
And in so doing, you protect and you save a child's life.
I love that. And so if we suspect that, then who should we call? Just tell us the numbers. Who should we contact?
So it's a hotline, 32322-2763, or simply 711.
Okay. Well, it's been a pleasure having you on. Thank you for all of the work that you're doing to protect these children.
Thank you.
All right. Ladies and gentlemen, you've been watching Bahamas at Sunrise. We'll be right back.